Hi, and welcome to another little video about Asperger's and children with Asperger's. This video is going to primarily contain information to help you look for possible symptoms of Asperger syndrome in children, children under the age of like 12, before they reach adolescence, really. So what we're talking is like elementary kids and down for the most part. But I'd also like you to take a look at aspergerscare.blogspot.com because we're going to have information on there regarding what we're talking about today, plus also symptoms for kids during their adolescence and even into adulthood. Plus, on the site, you'll also find stories from others and how they cope with Asperger's and how parents cope, how the individual copes, and from a children's perspective all the way up through adulthood. People talk about their experiences, and also you can learn techniques to help you get through this. So again, that's aspergerscare.blogspot.com. So how would you know if your child has Asperger's? Do you know the signs? Do you know what to look for? It's a very difficult thing to dissect because it's something that can fall in between the cracks of ADHD, ADD, autism, and many other things. But one of the biggest things that you need to look for is social awkwardness. Your child just doesn't have the ability, to communicate well with others. Some of these symptoms in the social realm is not picking up on social cues, meaning the child just can't read other people's body language, like maybe a hand on the hip showing a little bit of unhappiness with the child, or a frown on someone's face might indicating that they're not happy with something that the child has done, but the child with Asperger's just can't pick up on that. Also, there's starting and maintaining like one-sided conversations. Their children with Asperger's are often very tuned into a specific interest, and their scope of sociable skills kind of is very narrow, and all they want to do is talk about what they're interested in, and will even sway conversation back to what they're interested in, or won't even let the other person talk. In fact, taking turns talking is another aspect of Asperger's and the social awkwardness that comes with it. So another few symptoms here are not being able to recognize differences in speech, tone, or pitch. Like your child might not be able to understand when you ask a question, you raise your voice, the inflection or tone. And this is a confusing thing for a child with Asperger's. They don't understand that a lot of the times. And also things that alter the meanings of a phrase, such as sarcasm. Sarcasm is a huge problem for children with Asperger's. They just don't get it. So things like where they're making jokes and fun, and normally children would participate and get the sarcasm and joke along with it. The child with Asperger's is going to feel left out and almost like picked on because they don't get what's going on. So again, there's talking a lot, usually one-sided conversations. A big consistent factor that goes with Asperger's is internal thoughts that are verbalized. They'll speak out loud almost anything. And as a parent, when your child is doing something that's just awkward, something that doesn't make sense with the context of what's going on around them. And you have to dissect this with your child, because in the social realm of things, like all kids are a little bit different. They grow up in different rates, different phases, and so you'll know when your child is not acting appropriately or with what makes sense, common sense, in a given social situation. And also motor skills are another thing that come along with the Asperger syndrome. They're often late in developing motor skills, such as a younger child being able to use a spoon or utensil very well when they should be already. Um, then there's also um, like walking and in the first thing in the morning stumbling around and not being very aware of their surroundings. Those are definitely some things to consider when you're looking at your child and thinking possibly that they might have Asperger syndrome. So again, take all this information, look at your child, possibly make some notes, and if you think there's a possibility your child has Asperger's, take your child to the doctor. It's getting a little bit easier for doctors to admit that maybe Asperger's is a real thing and that Asperger's is something that your child may have. And so next time we're going to be talking about symptoms of Asperger's during adolescence. So be sure to check out aspergers.com, aspergerscare.blogspot.com, and again learn from stories from others and how they coped and techniques to be able to help your child and yourself in getting through some of the more difficult phases of Asperger's. Thank you for watching.